Wash your hands thoroughly, using soap and water for 20 seconds, or use hand sanitizer before testing, and dry your hands. Check the kit contents before testing. Sterile swab. Instructions for use. Disposal bag. Individually foil packaged test cassette. Extraction buffer tube. Check the expiration date on the package before use. Do not use the kit contents beyond the expiration date. Open the foil package along the tier line. Take the test cassette out from the foiled packaging and place it on the flat and clean table. Make sure the test cassette is intact. Do not use the cassette if there is no desiccant in the foil package. Hold the extraction buffer tube firmly in your hand. Carefully unscrew the cap on the extraction buffer tube. Build the extraction buffer tube into the slot in the test kit box. Use the sterile swab supplied in the kit to collect a nasal swab sample. Open swab package and take out the swab. Do not touch the soft, fabric tip of the swab with your hand. Tilt the head back about 70 degrees. Gently insert the entire absorbent tip of the swab into one nostril. The swab tip should be slowly inserted about 1.5 centimeters, parallel to the top of your mouth, not upwards, until resistance is encountered. Rotate the swab in a circular path against the nasal wall at least 5 times, about 15 seconds are needed. Remove the swab from the nostril. Using the same swab, repeat the action in another nostril. Caution: it is important to collect samples from both nostrils using the same swab. Immerse the nasal swab sample into the extraction buffer tube. Roll the swab at least 3 to 5 times. Leave the swab in the extraction buffer tube for 1 minute. When removing, roll the swab head toward the inside of the extraction buffer tube at least 3 to 5 times and squeeze the sides of the tube to extract the liquid from the swab as much as possible. Put the used swab into disposal bag. Screw the dropper tightly onto the extraction buffer tube. Add 3 drops of the processed sample into the sample well. Start timing the test by setting the timer for 15 minutes. Do not handle or move the cassette until the test is completed and ready for interpretation. An interpretation is available within 15 to 20 minutes. Do not read the results after 20 minutes. It may provide false results. After the interpretation is completed, replace the dropper with extraction buffer tube cap. Put the used buffer tube, dropper, sterile swab, test cassette into disposal bag. Seal the disposal bag tightly and place it into a household waste. After completing all steps, wash your hands or use hand sanitizer. Interpretation of results. Positive result. Both colored test line, T, and colored control line, C, appear on the test cassette. No matter which linicolored first, 2-colored line on the test cassette should indicate a positive result. Within the specified observation time, a weak-colored test line, T, should be judged as a positive result. A positive result means you may be infected with COVID-19. Please contact your local health authority for further advice on whether a PCR test is required to confirm your result. Negative result. Only the colored control line, C, appears on the test cassette while test line, T, does not appear. It should be judged as a negative result. You may not have infected with COVID-19. A negative result indicates that SARS-CoV-2 virus is not detected in the nasal swab sample. Negative results do not rule out SARS-CoV-2 infection, particularly for patients who have been in contact with known infected persons or in areas with high prevalence of active infection. Continue to follow all local guidelines and measures when in contact with others, as you may be infected. Invalid result. If no control line, C, is observed, the test result is still invalid even if the test line, T, is colored. An invalid result cannot be interpreted. An invalid test result should be repeated with a fresh sample and a new test.